Okay, once more, good afternoon to everybody. I am going to, let me start by introducing myself. My name is Ariel Burgess. I am President and CEO of the International Institute. We are hosting this weekly conversations or weekly update because as we all know, the circumstances of the Afghan arrivals has been changing almost by the day. We're constantly being updated by our federal partners, and we're also constantly having questions come to us from rightfully invested community stakeholders, and we felt that just creating this update would be an opportunity for us to put everybody on the same page for as long as needed. So we intend to do this on a weekly basis, but as the circumstances change, it may not be weekly. Maybe it could be even twice a week, depending on what the circumstances are. But for now, we thought we should start with a weekly conversation. And we're just going to do based on our agenda, we're going to have an introduction of the International Institute, the work that we do for this first conversation. In subsequent ones, we may not. Then we will have an update on the status of the Afghan arrivals, and then talk a little bit about the needs. We see this as we are playing our part as the International Institute, but we see this as a community effort. This is a St. Louis effort, and we are opening up our extending our hand to everyone and every organization that is willing to participate in one way or another, because we want the outcome to be that St. Louis is a welcoming and inclusive community that offers opportunity for people who want to come here and live here and support this region grow. And what that will entail, there's not one organization seated at the table here today that has all the answers. It's going to be a collaborative effort of all of us. And so we do not say that we are the only people that have the answers. No. We're reaching out to you because we know that you can play a vital role in us accomplishing our common mission. So, like I started by saying that I'm Ariel Burgess. I'm going to be accompanied here with a team of people from the International Institute, and we will get an opportunity, not necessarily to meet everybody at the International Institute, but we're going to meet our key actors. We would start with an institutional presentation that's going to be done by the Senior Vice President of Programs and President of the Community Development Corporation here at the International Institute, who is Blake Hamilton. So I would invite Blake to begin with just an overview of what we do, how we do it, what it entails, and then we'll go on to talk about other details in resettlement, in education, in the workforce, and our social work, and in economic development. And I would bring other members of the team to speak about the specific areas. And then after that, we'll go to current needs and the circumstances that we face. So at this point, I'm going to turn this over to Blake.
Good afternoon, everyone, and thank you so much for joining. As Ariel mentioned, my name is Blake Hamilton. I'm the Senior Vice President of Programs at the International Institute, as well as the President of the International Institute Community Development Corporation. And today, to get us started, I'm just going to provide us with a brief overview of the situation as it exists today, but also who we are as an organization and how we support those folks who are arriving into our community. Today we'll be talking also about how this situation is a bit different from previous resettlement periods, as well as identifying some of the gaps and challenges. So a little background on the International Institute. We have served immigrants and refugees in our region since 1919, but we are the only refugee resettlement agency currently in the region that contracts with the federal government to do direct resettlement to St. Louis. At present, we operate 22 federally funded grant programs and a total of 34 grant programs that allow us to provide services to a wide variety of folks. That includes refugees, asylees, special immigrant visa holders, parolees, generally St. Louisans with limited English proficiency, as well as immigrants and their children. This gives us a wide set of stakeholders that we work with within the breadth of our programs, but also kind of focuses the conversation on the challenges that we are seeing right now when it comes to the breadth of arrivals, in addition to parolees and asylees coming from Afghanistan. To put things in perspective, this chart shows the number of new arrivals that the Institute has resettled through its resettlement program going back to 2016. 2016 was really the Syrian refugee moment here in St. Louis, where we had about 1,050 or so arrivals that year. But of course, in succeeding years, we've seen a dramatic decrease in refugees coming through the Institute to St. Louis. And that bottom very long bar is the anticipated arrival number that we are going to see in the upcoming federal fiscal year. That will be from October 1st through the end of September. And so what you can see there is it really is several years of arrivals going back from 17 through 2021, all happening in 1 year. And so how do we serve these new arrivals who are coming into our community? Well, we serve new arrivals through a variety of programs, but some of the key initial first touch services that we provide are listed here under housing and setups. And I don't want to get too far into this because we do have the directors and VPs of our programs who will be each presenting a little bit more about what they do. But this is just sort of a broad overview of the service that we provide. Additionally, we are listing some of the partners that we collaborate with to deliver these services. It includes health access, school enrollment, housing and housing setups, as well as access to adult education, job readiness, placement and training, as well as community orientation and economic development services for folks down the line. And these are just sort of the large bundles of the services that folks are able to access. Some of them are prescriptive within our programming. Some of them are fully accessible for folks who are just interested in accessing one or two of these. Other sort of services related to resettlement for new arrivals that we provide and are contractually obligated to provide as part of the refugee resettlement program include the provision of a hot meal linked to application for Social Security card, a 24-hour home visit after arrival, benefits enrollment, a resettlement plan, family budgeting, et cetera, et cetera. Again, I don't want to take up too much time with this, as we'll be kicking it over to my colleagues within the various departments to tell you a little bit more about what they do. But I do want to move on to touch a bit more about the current crisis. Currently, the current crisis really began in terms of Afghan arrivals on the 15th with the fall of Kabul. And as few as 5 days later, we were actually contacted by our National Resettlement Organization, the U.S. Committee for Refugees and Immigrants, to ask about our region's capacity for resettling Afghan parolees. In January of every year, we actually set our regional capacity statement in consultation with a lot of the partners on this call. We submit that to our national organization, and then we are given a number of arrivals, and that occurs in January of every year. This past January, for this upcoming federal fiscal year, we were approved for 1,050 arrivals. So those are refugees and asylees. On August 20th, they reached back around to us and asked about specifically Afghan parolees. And we committed to resettling another 350 Afghan parolees. Now, among the 1,050 refugees and asylees, there will be some Afghans arriving in that group, but there are many different countries of origin for the folks who are going to be arriving this upcoming year, including folks from Syria, Congo, and many other countries I know Ariel will get to in a moment here. But committing to those 350 on top of our initial stated capacity kind of began a process of really collaborating with many of the partners, and almost all of you on this call have reached out or had discussions with folks at the agency around how you might be able to assist, which is why you're invited here. But through that process, we've gained a little bit more clarity, and this information was provided to us by our state refugee coordinator, Paul Costigan, who's also on this call. This latest update was provided last Friday. And this is, again, a very fluid situation, but the latest data that we had were that there were 53,000 Afghans at military bases in the United States waiting for resettlement. From our understanding, the resettlement window will be very brief for these folks who are going to be predominantly these parolees. It will just be a matter of months that we'll be resettling these 350. That, of course, is in addition to the 1,050 that we'll be resettling in the year. In addition to the 53,000 that are currently on bases, there's about 10,000 folks who are on military bases abroad who are waiting to come to be processed in a similar fashion and ultimately resettled in places like St. Louis. So once folks start getting off those bases and beds are freed up, more folks will be coming in for that processing. Folks at these military bases are undergoing a variety of screenings, including health and receiving COVID vaccinations. These sort of health screenings and vaccinations being provided, and there's a wait period. And what we've been told is that folks are being held for 3 weeks after they complete these rounds of inoculations and vaccinations, and then will be released. And so that puts us on the timeline really for the first week of October. We'll begin to see sort of the front end of this initial wave. The expectation is that, again, this wave will last maybe a month or two before we maybe see another lull and maybe then another peak. But all in all, we do expect Afghan parolee resettlement to really conclude around the early part of 2022. Of course, this is all happening simultaneous to other refugee arrivals that we will be working with in other groups as well. So a couple of things about this scenario make it a little bit different from resettlement periods past. Including housing challenges. So what we're seeing right now is a confluence of challenges, part and borne by the pandemic, and really overall a lack of ability in the built environment to support large families. We do fully expect that the families that we're resettling will be quite large, with an average case size around 5. But that is an average case size, meaning we'll see families with 8 or 9. And housing under the circumstances is quite challenging, given not just occupancy requirements, but our contractual requirements of having different bedrooms for children of different genders who are over the age of 13. So we're really seeking a large number of 4 and 5 bedroom apartments, which will make housing not just centralized into one area of the city or one location or even in the city at all. We'll be having to look far and wide for housing opportunities, permanent housing opportunities for folks across the region. Those housing challenges beget other challenges then as we begin to look at remote services, not just during COVID, but beyond. As folks are being resettled into other parts of the region, we are seeking partnerships with organizations that can help provide space for us to be able to deliver some of those critical services, as well as expand our capacity for remote service delivery through technology and other means of getting information and connecting with our clients who are going to be resettled across the region. Another challenge here is that arrivals will come in waves. We're essentially operating 2 programs simultaneously, the Afghan Parolee program, as well as the Refugee Resettlement Program. We're going to see different cycles, which will cause us to spin up very quickly to address 30 or 40 individuals who are arriving in a week, and maybe have some more quiet weeks of resettlement. But the message to you all, our partners, is that this will come at us not in a regular steady stream, but in punctuated waves. Parolees that are arriving are currently ineligible for key refugee supports. And this is a key feature I want to reiterate, and Ariel will dive into a bit more detail on. But as of today, and again, all of this is as of today, right now, parolees are not able to access, parolee adults are not able to access food stamps, federal cash assistance, Medicaid, Medicare, or regular case management services available after 90 days, which is something that's available to all refugees through the Institute after arrival. This is changing by the moment. There's an expectation that in the continuing resolution or in any sort of budget that passes, there will be provision that may allow for refugees to access, or parolees, pardon me, to access some of the regular benefits that refugees can access, some of those which are listed here. But at this point, it is not known which or when that will be the case. On top of this, for us internally as an agency, there is a shift in the federal funding scheme. We still have not been communicated with around the funding for the Afghan parolees, how we will receive funds to administer support to these cases. There's a changing funding scheme when it comes to refugee resettlement, which has long been scheduled. But previously, we would receive funds after folks arrive to be able to support the case. All we know is that will be changing, but what that's creating now with 1 week left in the federal fiscal year is uncertainty about how funding will look as of October 1st and how that money comes to our pocket to pay our staff to do this service. These sorts of uncertainty kind of breed challenges when it comes to hiring. We expect to have a lot more positions available, but we're not sure when we'll be able to post those positions and get folks in place to help support the influx of arrivals. And I want to touch on it briefly before passing the mic. Some of the gaps and challenges, as I mentioned, housing. We're expecting a need for about 250 3 or 4 bedroom apartments, as well as 150 1 or 2 bedroom apartments. And of course, this is going to extend the footprint of resettlement in our region, which creates other issues when it comes to our capacity and supporting cases over a larger geographic area. I did mention that federal funding gap for parolees, as well as the pace of arrivals. Internally, the Institute's capacity is being tested when it comes to support because we have many unfilled positions. We could certainly use our community partners' assistance in broadcasting the job opportunities we have available. There are a lot of folks who are interested in volunteering, but we'd really be internally grateful if you could help us post these positions into a wide variety of locations so that we can broadcast the availability of roles that we have at present. The uncertain funding scheme I mentioned, facilities improvements are needed in order to accommodate the larger number of staff, larger number of clients that will be in the building. We are also seeking additional security on site, given the volume of donations that we've received, as well as the possibility for bad actors to implement a plan or otherwise menace our program in any kind of way. We're trying to put security plans in place. As well as transportation needs. Given the volume and the large cases, we're looking to expand our fleet of vehicles that can provide transportation to folks to critical meetings such as job interviews, as well as health screening appointments, et cetera. And finally, technology, be able to provide remote services, stay in contact with clients and ensure clients have the technology they need in order to access services as needed. But again, we'll go into more detail about this a little bit later in the presentation. So with that, I'll go ahead and kick it back to Ray.
Yeah, thank you very much. Thank you very much, Blake, for that presentation. The highlighting, obviously, that the circumstances now are very different, and that the dynamics of the information that we're having is changing. Just clarification. In the context of the Afghan arrivals, we're saying that there are going to be 2 categories of arrivals, and maybe Ariel is going to clarify that, but just in the context of the questions that are being asked in the chat, there will be those with the special immigrant visas, and those are those who would arrive with all their papers and work permit already processed and will access benefits. And then the humanitarian parolees are those that are still in the process. That means when they not make it to become to get special immigrant visas, and they are still in the process. And those were the ones that Blake was mentioning will not access the benefits that that he listed out. And so that's the difference of the 2 arrivals, just in context of the questions. We are unsure. We cannot comment on whether the government shutdown would affect the funding of the that's something that we are not in any position at this point to comment on, but that's a question that was raised, and I just wanted to clarify that if we do get any feedback from our federal partners, because they do update us, we'll obviously let you know. But we know that efforts are being made by advocacy groups across the country to ensure that the resources are made available to support the Afghan arrivals. With that, let's just quickly go over some of the various areas that I mentioned. First, we're going to talk a little bit about what is about resettlement. Ariel Burgess is responsible for that at the International Institute. If there's any one person who understands the intricacies of resettlement in this community, it would be Ariel. So Ariel, if you can introduce yourself, tell us what you do and what you're facing.
Sure. Well, thank you, R.A. and Blake, and thank you to everybody that's on the Zoom call. I really look forward to working with you to welcome our new St. Louisans to our community. My name is Ariel Burgess. I'm the Vice President of Client Services, which pretty much means that I oversee refugee resettlement that comes to St. Louis through the International Institute. I also oversee other departments, but the main role of the job is refugee resettlement. I'm going to talk a little bit about what we are expecting. And as everybody has said so far, everything is flexible, everything is open to change. So it really applies to today. I think we can nail it all down that it applies to today. Tomorrow it might change, but not within this hour. So we are expecting to get arrivals with very short notice. I've just been told that we might get arrivals with with 24 or 96 hour notification. What that means is my national agency doesn't tell me that there's an arrival coming, within 24 hours to 96 hours. So we've got to be scrambling and get everything ready to go so that we can welcome that new arrival into St. Louis. In addition to the short notice, which is kind of par for the course, we're a little bit familiar with that. Refugee arrivals are very variable. They tend to come in waves. 1 week or even 1 month, we may have many, many arrivals, and another week or another month, we may have very few. However, the need for housing and healthcare, transportation, benefits, and other services is constant, regardless of how many refugees have arrived in that week or that month. So this is my plea to ask you to please be patient with us as we match up the arriving refugees with the need that you are able to address. Just because we don't get back to you in that first week doesn't mean we don't need your housing or we don't need your transportation. It just means that at this week, everybody's been matched up and we're going to work on the following week. To give you a little example of how refugees come in waves, we can just look back at the past few months. In July, we resettled only 20 refugees, and they were from Afghanistan, DRC, Democratic Republic of Congo, and actually Ukrainians. And then in August, just last month, the arrivals jumped up to 55. We know why, because of everything that was happening with the evacuation of Afghans. But we had 55 arrivals in August who were mostly Afghans and some Congolese. And now in September, we only have 24 arrivals, and none of them are Afghan. All of them are from the DRC, Sudan, or Eritrea. So you can see just that wave and that variability going throughout the arrival scheduling. In addition, we have 4 walk-in parolee cases. Now, walk-in parolee cases are those cases that have parolee stamped on their visa, and they've walked into the International Institute, and they've said, we would like to receive services. They may or may not have left the base on their own. Whatever arrangements, their flight to their resettlement site was not scheduled by a national agency. So we call them walk-ins. In this month, since August, we've had 4 walk-in parolee cases, 3 single individuals, and a family of 5. I'm going to talk a little bit about this further, but keep in mind, parolees, whether they're walk-in or not walk-in, are not eligible for federal benefits or at this point, at least, for resettlement services, including the resettlement per capita. So that means that these 4 walk-in cases are not eligible for food stamps, Medicaid, TANF, or even Match Grant, which is a program that we have here at the Institute. Now, also contributing to the arrival wave function this year is that we will have a travel moratorium from October 1 through October 15th. That's very common. We always have a travel moratorium while the government decides what they're going to do with refugee resettlement and everything gets signed and stuff like that. However, during this year's travel moratorium, Afghans who are leaving their US bases will be scheduled for flight to their final destination at their resettlement site. So we are expecting to receive Afghans during the travel moratorium. We're just not going to be resettling other refugees. So not the Sudanese or the Eritreans or Ukrainians. They will be allowed to schedule flight after October 15th. Now, we do expect, like I said, for these Afghans to begin arriving into St. Louis in the first 2 weeks of September. Most of these Afghans are going to be parolee Afghans. There might be a few SIVs or a handful of SIVs, but the majority of them are going to be parolee Afghans. And remember what I just said, parolees are not eligible as of today for federal benefits. So we really need community support and your assistance in being able to hook up these individuals with their immediate needs. And some of those immediate needs, as you most probably know, are housing, whether it's permanent or temporary housing. And when I say housing, I'm not just talking about the actual physical dwelling, but how are they going to pay for housing? They have no access to any federal funds. So, how is there assistance to help them with their rent, with their utilities and whatnot? And we've seen a wonderful outpouring of the community with donated goods and financial contributions. And that will go away to helping these. But what I want you to really hear is that through October and through the end of this year, very likely we're going to continue to get parolees every single week, and that need will continue to be there throughout the rest of the year. Now, just to give you an estimate, and this is just off the top of my head, some people may say it's too high, some people may say it's too low, but off the top of my head, I'm preparing my staff that we could possibly start to get 40 individuals a week in October. That's 40 people. I don't know how many cases that would be, but we're trying to prepare for that. That in the first couple of weeks of October, it could be really busy. And then maybe the last week of October, it slows down and then it picks back up in November, slows down and picks back up. That's that wave that I've talked about a little bit. Just to kind of wrap up the classifications of Afghans, there are 3 classifications of Afghans coming to the United States. The first you may know, and those are the SIVs. They're approved, they receive federal benefits, they receive resettlement. And then there's the SIV IQs, or what we call the squishies. That's the second classification. This classification are eligible for some benefits, not all benefits, but they are also eligible for resettlement services. Now, the Afghan parolees, as I keep hammering home, are not eligible for any federal benefits or resettlement services currently. We're hopeful that the Welcome Act, which was passed in the House, will eventually become passed sometime in October, hopefully. And if that is passed, that is a program that will allow Afghan parolees to have access to all federal benefits and resettlement services that other refugees have access to. I've talked a bit about what we're expecting in St. Louis and some of the needs. I know that the needs will be another category, but I do want to just throw out there for people to start thinking about that in addition to housing needs, we also have needs for these Afghan parolees and other refugees for healthcare access and transportation. We're finding that with many clients choosing to live closer to their US ties or their family relatives in St. Louis, they typically are going out to the county and far out in the county. And we're happy to have housing in the county. However, transportation becomes an issue and getting back and forth to the Institute for Services. So those are the three needs that I would suggest that we are able to start thinking about and addressing later on in this meeting.
Thank you very much, Ariel. I would say to everybody that as we go along, if you have any questions, you know, we have somebody, Kerry is tracking the questions or keeping up with the chat in the chat box. But if you have any questions, please feel free to pose those questions so we can address them as we go along. Grateful that we have Aya from Representative Corey Bush's office. That is also helping us address some of the federal questions, and we thank them for the efforts that they are making with the continuing resolution. Once people arrive, we provide housing. The next step is an assessment. We have to get the children into school. We have to get them speaking, assessing their English language levels, and that's where education comes in and our education department. So I'm going to turn this over to Anita Baker to talk a little bit about what we do in that domain.
Thank you, Ari, and thank you everyone who's on this call. It's really amazing and has moved all of us to tears to see the amount of support and welcoming spirit that the St. Louis community has for all of our new arrivals. I'm just going to quickly share that since the shutdown of the pandemic, the education department that I oversee here at the Institute has continued to offer many adult education programs that are grant funded or that we have referred to St. Louis Public Schools Adult Education and Literacy Program that has provided ESL for many of the clients that we've served over the years, for many, many years. And then in addition, we've also had programs for youth that continued. And we did all of this virtually when the pandemic happened. I often think that our high school after school program for the newcomers in collaboration with St. Louis Public Schools New American Academy, housed over at Roosevelt High School, right around the corner from where we are, was a wonderful academic lifeline that we were able to offer for these kids, especially after the shutdown, and many of them needed digital literacy support. We are a Microsoft Teams organization, so that helped us enable the kids to participate in their Microsoft Teams education through the St. Louis Public Schools. We also have citizenship classes that we have continued to provide remotely, but as we get closer to the new reopening of our institute, we're gradually starting to open up to in-person classes to support those who have been here for a while and are ready to apply for citizenship, as well as those who are in the ESL literacy level. Thankfully, the Marillac Mission Foundation, our fund, has enabled us to offer a literacy level English class as well as a transitions education class for new arrivals that is very client-centered before we refer them to the existing adult ed programs in the area. And finally, I'll say that we do and have had a career advancement for international professionals program. This is open not just to refugees and asylees and SIVs, but also any immigrant who's college educated and interested in learning the skills to enter the United States workforce in a more effective way, closer to their career. Lots of different programs that we offer here, and I'm so thrilled that you're all here, and thank you so much for all the support that you are ready to provide.
Thank you very much, Anita. Anita is going to, and her team are going to get really busy here once we start seeing this wave of arrivals, because we have to also integrate the children into the educational system here. The next is going to be workforce. We're going to talk a little bit about workforce. We're really being contacted significantly by employers in the region about how, with great gestures, about offering opportunities to integrate the Afghans upon arrival. So I'll turn this over to Chelsea Sheridan to talk a little bit about what that looks like, what workforce development solutions looks like at the Institute.
Hello, and thank you, Aray, for that introduction. So our Workforce Solutions team at the International Institute focuses on job placement and career advancement services for our new American clients. And when I say new American clients, it is very broad in that definition because our department serves individuals such as our newly arrived refugees, SIVs, and other individuals, as well as folks that have been here a bit longer but still struggle with navigating mainstream workforce development systems or on their own. We also are able to serve work authorized immigrants through one of our job placement programs and our career advancement service as well. So we really are trying to meet folks where they're at along their career pathway and along their employment journey. Our job placement services are often centered and focused on finding employment quickly that can help support and sustain individuals, particularly those, for new arrivals past that resettlement period and after that funding ends. But also, like I said, along, as their needs change, as their family dynamics change, we're really here to kind of help support along that journey. Directly related to the new arrivals that we've been speaking about today and the Afghans in particular, we as with any of the individuals we engage with, we really want to help prepare folks for the workforce. Although refugees, SIVs, and other individuals are immediately work authorized upon arrival in the US, we don't feel it prudent to send somebody to a job, within 2 days of their arrival. So we really try to do some basic employment preparation through our job readiness class and some additional coaching that our team focuses on. So what we've been primarily doing over the last few months with our newest individuals, including the Afghan SIVs and arrivals, has really been engaging with our job readiness class. And then upon completion of that 2-session class, we also offer an interview practice to get that individual some semblance of what an interview may look like in the US before engaging them with our job search services and really digging into what their needs may be, what their experience may be, the transportation and childcare restrictions and requirements are. Dr. Gonzalez del Castillo parolees are not immediately authorized. The Afghan humanitarian parolees are not immediately authorized to work. There is going to be hopefully opportunities for these individuals to apply for work authorization, but that's not immediately granted. And it's something that we're still trying to navigate through. But once they do receive work authorization, our team would then be able to assist them with navigating employment. So we're definitely keeping very close ears and eyes on that situation and when that might be possible so that we can hopefully engage them with employment. So again, after the employment preparation, we do work to get folks connected to opportunities that meet their needs, their experience, their goals, and their transportation needs, right? Based on where they're living and based on each individual's situation. At this time, for many of the Afghan individuals we've been serving, many of those folks have also been related to individuals that are already here or have family ties, as Ariel mentioned. And so oftentimes we're also finding out that many of these family members have jobs lined up for some of these folks before they even arrive or very soon after they arrive. So before we can really connect with them. But of course, that's not going to be for everyone, that isn't for everyone at this time as well. So we are very able and ready and eager to connect with individuals for employment opportunities or to help guide them if they find them on their own in terms of support and documentation or whatever those next steps may be for them to be successful in their work. We've been very fortunate, as Aray mentioned, to have not just over the past month, but really over the past year or so to see a great influx of interest from area employers to connect, but that's really doubled in the last month or so, I would say, as we see more and more interested individuals, companies, entities, organizations connected to offer job placement assistance or just to be interested to connect with our services. And so we've been very, very fortunate, very, very thankful, but we also have been really careful in how we craft our message because at this time, as we've been mentioning, we've seen folks arrive and our candidate pool is growing from what it was earlier this year or even, at different points of the year last year, but we're not at that 1,000 mark. We don't have 1,000 individuals sitting, in our agency or at their homes waiting for jobs at this point, but we do know that they're coming. And so what our team is working to do right now is to assess the opportunities that are coming through and to identify those that we may be able to refer or get folks connected to immediately, but also those that are great opportunities or that may be wonderful to connect with in 6 months' time or down the line as we continue to see more and more individuals. And while any job opportunity is wonderful, we are really looking for self-sustaining wages. We're really not looking to put folks into minimum wage roles, right? We're really trying to find a diversity of opportunities as well, because people are coming with diverse skill sets and backgrounds, and we really want to try to be able to match that as best as possible or to leverage those rather than placing everyone into the same type of job or the same type of role. For September, our minimum, our average wage, I should say, for the month across all the folks that we're serving is right around $15. So we're really fortunate that we have a lot of what we consider to be more self-sustaining wages, although, $15 isn't completely, but versus minimum wage, we feel that, we want to try to find these opportunities for folks, with a diversity of skill sets and also, different pay rates and benefits as well. So right now, just as an ask or a need, we've been communicating with all those that are reaching out to us and thanking them for their interest, letting them know that our team reviews and screens the opportunities and is happy to, connect folks as it is possible right away, but also that we are happy to keep it on file and to loop back in the future. We're really hoping to be able to connect with many of these folks over the next year as we continue to serve individuals. Our team really does a vetting process and a screening and a deep conversation with clients prior to referring them. We don't want to set folks up for a situation that they may not be prepared for or may not be interested in. So it's not necessarily just sharing a job opportunity with folks. We really do a screening and a vetting process and really spend some time to talk about that job with the individuals prior to referring. So our process, although it takes a little bit more time, we find it to be really efficient and effective for, more understood placements on both sides for the employer and for the client. Our main challenge at this time, as Blake kind of alluded to, is staffing. Our department's going through some changes and as some folks transitioning and moving into different areas. And so we really are honestly looking for more folks to be filling those positions. And that's our biggest ask at this time. In terms of other employers, if other folks are reaching out to you or eager to, we're happy to get connected, but it's not something where it's just get connected now or never. We really value partnerships and long-term connectivity amongst employers. And we really are looking for a diverse, not only entry-level roles, but really roles kind of across the spectrum, because we may be serving individuals with roles of various backgrounds, educational experiences, et cetera. So that's our little pitch and our spiel at this time. And thank you.
Thank you very much, Chelsea. At this point, I'm just going to turn it over to Rosemary to talk a little, Rosemary Lang, who will talk a little bit about our social service, social works, the support that we provide to our immigrants when they arrive. So Rosie, over to you.
Thank you, Ray. Good afternoon, everyone. Thank you so much to my colleagues who have shared before, really everyone for taking the time out of their afternoon to be here and the support that you continue to provide. In the interest of time, keeping an eye on the clock and the agenda, I'll keep it brief. A very short background on the social work department and our services. We are essentially charged with providing trauma-informed, strengths-based, and person-centered services to some of our most at-risk populations that we have within the general population here through the Institute. And this really includes those that have the most barriers. We provide services under 4 primary buckets, some of which intersect and includes intensive case management, behavioral health services, elderly services, and then specialized services for survivors of trafficking in persons. Most relevant to this conversation, I think, is our intensive case management and elderly and behavioral health services. In terms of intensive case management, we are continuing much as we did before, striving to walk with our clients in navigating what we all here on the call know is a very complex system that individuals face upon arrival. We have a strong focus on crisis stabilization for those who are experiencing really significant barriers and issues such as complex medical issues, complex trauma history, developmental or intellectual disabilities, intimate partner violence, and so on. And so we work to assist individuals in accessing the services and other resources that they need to support their health and well-being, and really whatever they determine means success for them. We do have the capacity to offer screenings for behavioral health. And dependent on client need and readiness to engage, we also offer therapy that's either in-home, in-office, or via telehealth platform. And again, that's really person-driven, client-driven. Another thing to note is that our behavioral health and intensive case managers really work hand in hand along with many community partners, a number of which I see on this call today, to coordinate care for our new arrivals. Right now, as Blake and Ariel and several other people mentioned, related to the increase in Afghan arrivals specifically, one of the gaps that we're most concerned about is connectivity and access for those humanitarian parolees. Because that does present a degree of risk, right, for them if they don't have access to these benefits and services. And so we have a really keen interest on developing some hopefully temporary safety nets until a longer term fix becomes available. And again, being mindful of time, I'm going to cap it there. Thank you so much.
Thank you very much, Rosemary, for that comprehensive. We know that we have to pay attention to that long-term need and helping people stabilize. And talking about long-term, I'm going to bring up Nadia Kanim from who is a director here for economic development. And she's going to talk about what we see down the road as the Afghans begin to settle here. So Nadia, over to you.
Good afternoon, everyone. Thanks for attending this session. As we know, immigrants create demand for small businesses and strengthen the economy. Some of the most influential entrepreneurs in the United States are immigrants or children of immigrants. Per Center for American Progress research, they said, apart from immigrants' contribution in big businesses, they have also made impact as small businesses entrepreneurs. Immigrants make up about 28% of small business owners and are 2 times more likely to become entrepreneurs than the native-born population. And as we know, IISTL always provide good services for a new American. IISTL decided to open services for entrepreneurs and for people who wants to start up their business. We opened IICDC in 2007. IICDC International Institute's Community Development Corporation. It's a CDFI, Community Development Financial Institution of the U.S. Department of the Treasury. IICDC provide a lot of different services. We provide business microloans, provide financing, and consulting to start up, strengthen, and expand businesses. We help entrepreneurs to write a business plan. We help them with cash flow management, and we help them with a lot of different financial statements. We assist the clients to get the legal documents they needed to start up their business or to expand their business by connecting them with a specialized organization that we partner with. We also help them with the business marketing, as well as a lot of services that we provide as needed. The other product or the service that we have is a credit builder loan. This is to help them empower our clients to establish a new good line of credit that improve their credit history and credit score, as well as we provide a session, consulting session or training 1 to 2 hours plus the credit builder loan. The other service that we have at IICDC, the citizenship loan, to provide financial support to apply for immigration services, including but not limited to work authorization card, permanent resident card, naturalization, and family reunification. The other service that we have in here is the asset program. And this is the grant that we get from United Way. They have to save toward the goal, get match on every dollar to put toward the utility bill, or it can go to build up any asset they want, a car, or it can be paid to secondary education, as well as they can use it to pay for driving school if they want to learn how to drive. And a lot of other services that we have, plus the financial literacy classes, food pathway program, and also we help them with the free tax filing assistance. We have volunteers from AARP. We do it during the tax season. If you are interested to learn more about IICDC services, you are more than welcome to email me, and I'm going to drop my email down here in the chat. Thank you.
Thank you very much, Nadia, for that also comprehensive outlook of how we support the immigrants really get settled in this community. At this point, we're going to just go in quickly, mindful of the time. I'm going to turn it over to Kelly to just give us an update on where we are with reference to donations and volunteers. And then then we will wrap up with just the current challenges or the current needs. So Kelly, please.
Thank you. So the first thing I want to say is thank you so much, community members who are on this call, for providing such a wonderful support in the last 3 weeks. We've seen an abundance amount of donations come in, and for that reason alone, we have in the last 2 weeks paused the collection of in-kind donations. I'm thrilled to announce that we have a gym full of donations plus a secondary warehouse right now that we are organizing. That means that we are taking some time right now during this pause to reorganize the donations and have it set up in the space where we can accept more in the future and then distribute. You know, we've all been talking about these arrivals coming in October. We want to make sure that the donations are ready to be distributed the 1st of October. So in terms of volunteers, we will be advertising on our website when we have needs for volunteers. Currently, we're working on Tuesdays and Thursdays, basically from 8:30 to 3 p.m. in organizing and motivating people to come and help organize. All other announcements will be on our website. We also have a general interest form on our website. And I noticed that Anita noted that she's looking for mentors for her youth program. So if that's something that you are interested in, definitely go to the website. Carrie has also just now posted the weekly opportunities in the chat. And so if you have a group, you can also email me and we can arrange for a group to help volunteer as well. Thanks so much. And thank you again for your wonderful support.
Yeah, thank you very much, Kelly. This is the lay of the land. Let me reiterate on behalf of the team at the International Institute, the board of directors of the International Institute under the chairmanship of Ariel Burgess, and the people that we serve, our gratitude to the community for the incredible outpour of support that we've had in the last month. To the extent I thought that this community was generous, but I wouldn't have imagined that it was this generous. And it was demonstrated by how we as an institute completely ran out of capacity to be able to manage that. And we took some time to deliberate how to approach this. We have brought in some professional support to help us with just managing the donations and managing the thousands and thousands of volunteers that are stepping up to support us at this time. So that is something that I wanted to highlight. And secondly, that we think we're in a position now where we're almost in control of the circumstances. We will eventually identify the specific needs that we have in terms of donation and be able to reach out to the community. We've also put out a call to the wider community about an overall plan that we see, what the funding gaps could be, and we are having several conversations with some of you here around ways in which you could help us close that gap, and we really appreciate that. We've also seen significant, let me be very very, very frank, significant traffic on our website in terms of donations. We've had over 1,300 new donors in the last month, upwards of about $220,000 in donations have come in. We are now receiving a significant number of gift cards. Those gift cards intended to provide provisions and support these families. But even as I speak about what we have received, and in contrast to what is coming at us, there's still going to be a need for us to close the gap. Within the time that we have left, I'm just going to turn this over to Blake to reiterate some of the big needs that we have and how people can step into support. But this is an update. We will continue the conversations with you all. We will be taking your questions, and we'll try to do this as often as we can so that you're all on the same page.
Yeah, and I just want to reiterate, this is the first, not the last, right? And in this one, we really want to provide an overview so that all our stakeholders here are all on the same page and understanding what we have available, what kind of the needs are. As we move forward with these conversations, we'll be updating and talking more about specific needs, diving deeper into things like housing, like access to education, other ways that volunteers can support and really allow our many partners who are on the call today to step up to talk about what they're seeing as we're seeing more arrivals come in and help us identify needs that we can partner together to meet. I do foresee a time in the near future where we'll be able to have some sort of breakout sessions, convenings tables around specific issues like education, like economic development or employment or health, access to health and mental health resources. This is a very complex challenge that we're seeing, not just with refugee arrivals, not just with Afghan arrivals, not just with Haitian arrivals, right? We're seeing many folks enter our community with myriad need, and we're very encouraged to see the community stepping up. And we want to be able to work with our partners and other providers who are serving the folks that we serve to ensure that we're fostering and welcoming community for all. So again, I just want to thank you all for attending here today and look forward to staying in touch with each and every one of you.
Thank you very much, Blake. Next week, our session is scheduled. Next week, September 29th, is scheduled for 10 a.m. We will be sending out the invites for the session for next week, as well as, we can assure you that there will be lots of updates because we get these updates as often on a daily basis, so to speak, from our federal partners. Some things change, some things don't change. And what we're keeping an eye on is that the continuous resolution that's taking place, because that would really determine what the outcomes would be. I know we've been saying that we're expecting 1,400. Keep an open mind. We could shoot slightly under that, more looking likely as over that. So that's just an open mind. But that's what we wanted to share with you today. This week has been a lot more of understanding of what we're doing. Next week, we'll be going really into the specifics of what we're seeing in terms of resettlement, for example, and how we're addressing some of those solutions. And like I said, we're open. We will be listening to you. We will be working with you. We're going to do this together. Thank you very much for your time.